You're in a routine checkup expecting a quick, you're fine, and your doctor tells you your blood pressure is high, even though you're doing most things right. That's the quiet trap of insulin resistance and high blood pressure, where years of constant snacking and late night eating push fasting and blood pressure in the wrong direction and build up primary hypertension risk factors long before the numbers set off alarms. In this video, we're going to talk about how changing when you eat using simple, realistic fasting habits can help lower blood pressure by improving insulin resistance so that timing of your meals actually starts working for you instead of against you. High blood pressure isn't just one thing, and that's why understanding the difference between primary versus secondary hypertension matters. Primary hypertension is the slow, lifestyle driven kind that builds up over years. Secondary hypertension has a clear, fixable cause, like a kidney or hormone issue. So, knowing which one you have tells you whether you just need better habits or a deeper medical workup to find and treat the real trigger. And if you're new here, I'm Dr. Gayla Gorman, a licensed acupuncturist, naturopath, and author of What's Your Kryptonite? If you'd like to connect with me, use the QR code on the screen or go to drgayla.com/links. On this channel, I'm here to help you reverse the effects of chronic stress so that you can cruise through midlife and beyond symptom free. Before we get into fasting, insulin, and the why, it helps to get really clear on the what your body is actually doing day to day. So let's start with how blood pressure tends to feel for women in midlife, because it rarely shows up the way you've been taught to expect. Most of what women in midlife hear about hypertension symptoms can seem alarming, but the reality is that the signs are often subtle and easy to miss. High blood pressure often builds slowly in the background, showing up as normal life stuff you can easily blame on stress, poor sleep, or hormones, which is why so many women are surprised when the cuff at the doctor's office says there's a problem. The important thing is not to wait for obvious symptoms, but to notice the small changes in your body and to just check your blood pressure regularly so you can stay informed. The most common symptoms are vague: more tension headaches, feeling wired but exhausted, or brain fog that you chalk up to being busy or perimenopausal. You might notice getting winded faster on stairs, a heavy or tight feeling in your chest when you're rushing, or brief spells of dizziness or blurred vision that you shrug off as low blood sugar or fatigue. Because insulin resistance and high blood pressure often travel together in midlife, especially with stress eating and late night snacking, those subtle changes are your cue to start paying attention. Not panic, but get curious, check your blood pressure, and see what your numbers are actually doing. For women in midlife, a 2023 review in Archives of Medical Science highlights that blood pressure and overall cardiovascular risk rise noticeably around and after menopause, largely due to falling estrogen, shifts in body fat toward the abdomen, and increasing insulin resistance, all of which feed into essential or primary hypertension. The authors of this particular paper note that early menopause and a history of pregnancy complications like preeclampsia are primary hypertension risk factors. And they emphasize lifestyle strategies, including weight management, physical activity, and dietary changes, as central evidence based tools for women who want to protect their heart and blood vessels as naturally as possible. Noticing symptoms is step one, but the real benefit comes from understanding why they're happening in the first place. Those quiet headaches, the breathlessness on the stairs, the wired but wiped feeling are all signals, but they're downstream of something. So let's zoom out and look at the main primary hypertension risk factors that tend to stack up for women in midlife. and how they quietly push blood pressure higher long before it shows up as a diagnosis. If you're trying to understand how fasting, insulin resistance, and blood pressure all fit together, especially in midlife, you'll find some specific suggestions in one of my other videos, Food Diet Hacks for a Healthy Heart, Women 40 Plus Swear By. The link should pop up right here on your screen, and if you miss it, no worries. I've also included it in the description below. Primary hypertension doesn't just appear suddenly, especially for women during midlife. It usually develops over time from several risk factors adding up, like hormone changes, daily stress, and small shifts in weight or metabolism. Paying attention to the habits and factors that affect your blood pressure can help you manage it more effectively instead of feeling like your body is working against you. Central weight gain, especially around the belly, which many of us in perimenopause or menopause experience, or insulin resistance, if you know that that's what you're dealing with, and even a more sedentary lifestyle, meaning you don't move enough, are some of the strongest primary hypertension risk factors for women in midlife, even when your overall BMI doesn't look that alarming. Chronic stress, poor sleep, and over reliance on ultra processed, salty, or convenience foods quietly keep blood pressure elevated, and they often show up right alongside these perimenopausal symptoms. So it's easy to miss the connection. And remember what I said a moment ago, a history of pregnancy complications like preeclampsia, early or intense menopausal symptoms, family history of high blood pressure, and long-term smoking or regular alcohol intake add extra weight, not necessarily just around the middle, to the risk picture. This makes it even more important to look at insulin resistance and high blood pressure and your daily habits and even your fasting and blood pressure patterns as part of the same story. You've just seen how those risk factors quietly stack up and push blood pressure higher over time. That's the what. The next question is what you can actually do about it that you can stick with. This is where insulin resistance and high blood pressure come together, and where simple changes to your fasting and blood pressure patterns start to become a real lever you can pull instead of just another thing to feel guilty about. The truth is, these are just signals, and for so many women in midlife, the real accelerator behind insulin resistance and high blood pressure isn't just food or hormones. It's stress that never fully lets up. When you start connecting your fasting and blood pressure pattern, your primary hypertension risk factors, and the way your nervous system is always on, it becomes a lot clearer where to focus if you actually want your numbers and your body to calm down. We've just mapped out the main primary hypertension risk factors that tend to stack up in midlife: hormones, stress, belly fat, sleep, food, and your family history or genetics. The next step is understanding the one thread that quietly ties so many of these pieces together. That's where insulin resistance and high blood pressure come in. Because once you see how insulin, salt retention, vessel stiffness, and even your fasting and blood pressure pattern all connect, the whole picture of why my numbers are high starts to make a whole lot more sense. Insulin resistance is one of the most important and most overlooked drivers of high blood pressure for women in midlife. When your cells stop responding well to insulin, your body keeps making more of it. And those higher insulin levels tell your kidneys to hold on to sodium and water, tighten up your blood vessels, and keep your nervous system in more of a turned up state, all of which nudge blood pressure higher over time. For a lot of women who feel like they're doing most things right, this quiet insulin story is the missing link between normal labs, creeping belly fat, and blood pressure readings that suddenly start living in the high range. Insulin resistance often shows up as increasing weight size, stronger carb or sugar cravings, mid afternoon crashes, and difficulty losing weight. And it frequently travels with rising blood pressure even before glucose or A1C look pre diabetic. Higher insulin levels make the kidneys retain more salt and fluid, increase sympathetic fight or flight tone in your nervous system, and promote stiffer, less flexible blood vessels, which is why insulin resistance and high blood pressure so often show up together as part of the same pattern. This is also where fasting and blood pressure fit in. Gentle, realistic fasting strategies like a consistent 10 to 12-hour eating window, fewer late night snacks, and less grazing can lower insulin levels, improve metabolic flexibility, and over time help reduce primary hypertension risk factors from the inside out. Not just chasing the numbers that show up when you have to put on that blood pressure cuff. We started with that scene in the exam room, going in for that quick checkup, expecting you're fine, and instead finding out your blood pressure is high, even though you feel like you're doing most things right. That moment makes sense now. Quiet hypertension symptoms, stacked primary hypertension risk factors, and underlying insulin resistance. These all fit together to create a picture that indicate that you're at an elevated risk of developing high blood pressure, and they all feed in to essential hypertension over time. So if you're wondering, can I actually change this? The good news is the answer is yes. By improving insulin sensitivity, tightening up your eating window, and addressing those core risk factors, you can move your numbers in a better direction instead of just waiting for those numbers to get worse or doing something even riskier, and that would be turning to medication to control your blood pressure. Blood pressure cannot be effectively controlled with medication. Your blood pressure is most likely fluctuating if you're in this sort of situation where you've developed higher blood pressure as a result of insulin resistance. And so if you try to medicate that, you will find that your blood pressure will actually fluctuate to dangerously low levels, even if it manages to control it at the higher range. And so this just really is not the approach that you want to take. Medication is always a last resort option. And if your best efforts to live a healthy lifestyle and do all the things you've been led to think are supposed to work aren't getting the job done, you may even be feeling like you take 2 steps forward and 3 back. I have more resources to help you navigate midlife. Just go to drgala.com/links and watch my next video, where I show you how to manage the toxic stress that's sabotaging your efforts. You can eliminate the symptoms that seem to be piling up in midlife naturally without medication, crazy diet, intense exercise, or any other unsustainable lifestyle hack.